Hi everyone, I'm Dr. Parissis. I work in London, UK, in partnership with Dr. Feller and Dr. Bloxham in Great Neck, New York. What I'd like to do today is discuss hair transplant surgery in South Asian patients. I want to talk about some of the factors that need to be considered when doing hair transplant surgery on these patients. So here we have our patient who came to us in his 20s, and he was complaining of that kind of diffuse hair loss across the scalp here. His hairline was relatively preserved, hadn't really receded, but he had experienced quite a lot of loss throughout the scalp, a sort of generalized loss. He wanted to grow his hair out long, and he hadn't been able to because these hairs were really quite unhealthy. They were quite miniaturized. So really he came to us with the goal of tackling that kind of frontal half of the scalp. We wanted to take it one step at a time. So we wanted to do the front half first. Just before we go to the before and after, as I like to do on these videos, I wanted to take a little detour, specifically to discuss how common hair loss is in the South Asian population. We can see here this is an excellent study by Dr. Shankar, who looked at around about 1,000 patients. He found that the incidence, or how common male pattern baldness was in these patients, was around about 58%. 12.9% of them fit into that category of that kind of Norwood 4 or more. And just a reminder of the Norwood scale, that includes these patients right here. So we can see that, going up the scale is kind of more advanced hair loss. The other thing I wanted to discuss is what kind of pattern of hair loss do South Asian men tend to experience. Another great study by Dr. Grover, who looked at the pattern of male pattern baldness in South Asian men, specifically in Indian men. This is the section of that study I want you to focus on. We can see at the top here that the study outlines another study on Caucasian men in the USA who experienced predominantly frontal baldness. So that's that kind of recession of the frontotemporal regions that we see quite often in Caucasian men. This is another little study on Norwegian men, specifically Caucasian Norwegian men, and this reported that type 1 and type 2 was the most common type of hair loss seen there. So again, predominantly frontal. In contrast to those studies, in the study of Indian males, they revealed type 2 to be the most common. So, Indian men and South Asian men do experience frontal recession and frontal baldness, but after 60 years old, most of them experience some loss of the vertex. When I say the vertex, I mean the crown. So again, just a reminder that type 3V or type 3 vertex was very, very common in Indian men. And that's something that aligns with our practice. We see the crown go very, very often in South Asian men. Here we can see some excellent photographs of a patient that fits that bill exactly. He has experienced diffuse loss. He has his hairline relatively preserved. In fact, with this patient, I probably wouldn't even work in the hairline. It seems of good density. I would be likely to leave the hairline exactly where it is, but work in throughout this diffuse area of loss here. The crown has also been hit quite hard, which aligns with the paper we just discussed. I also want to think about the hair characteristics in the South Asian population, and specifically how those hair characteristics feed into our decision making in hair transplant surgery. So first of all, the color of hair in the South Asian population. This is a study by Dr. Palakurthi who looked at a lot of the hair characteristics in South Asians. Found that South Indians who had sort of darker skin, because they had black hair, the contrast between the hair and the scalp was less. And generally, as I've mentioned in previous videos, if the contrast between the hair and the scalp is less, that generally results in a better or more natural appearance of the hair transplant surgery. In North Indians, who tend to have fairer skin than South Indians, the contrast is higher. They still have black hair, but because of their fairer skin, there is more of a contrast. That's something to consider when thinking about how aggressive we go in hair transplant surgery. If there's black hair with fairer skin, we might want to break up the hairline a little bit more just to make sure there's a natural flush of the hair and the skin at the hairline region. The same study looked at how curly or wavy that group of Indian men's hair was and found that most of them, as you can see, 64% of them had straight hair. That is very important in hair transplant surgery. First of all, straight hair is easier to cut for the technicians, meaning we can deal with and process a greater number of grafts throughout the day, but also straight hair has less coverage than wavy or curly hair. Wavy or curly hair tends to clump together and therefore cover more surface area. So we might need to shoot for a higher graft number to achieve the same effect in these men. What about the diameter of their hair? So this is a reminder of what I mean by diameter of hair. What I want to emphasize is that, this is normal diameter hair. When I say thick diameter hair, I mean that the shaft or hair itself is thicker. The word thick is thrown around a lot. Thick hair can mean lots of hair, but thick hair can also mean that each individual hair is thick. So that's what I'm focusing in on here. Finer hair refers to each individual hair being of lower diameter. That same study by Dr. Parissis found that the average diameter of hair follicles in those men was 0.062 millimeters. Now, is that thick or thin? Well, the scale of hair diameter in humans in general of all ethnicities is 0.017 millimeters to 0.181 millimeters. So you can see 0.062 is kind of in that kind of low to medium range. Again, it's something to consider because we might need to put more grafts with these patients to get a good cosmetic outcome, since each individual hair is not as thick and therefore doesn't provide quite as much coverage as we're shooting for. About the density of the safe donor area in patients of South Asian descent. This is a study of 580 Indian men looking at the follicular unit density of the safe donor areas of these men. And it found that the average follicular unit density was 78.2 follicular units per centimeter squared. The question you're probably asking yourself is this high or is this low? Given that the density range for humans in general is between 65 to 85 follicular units per centimeter squared, 78.2 is relatively high. It's on the medium to high. So that means that we have more apples to pick from the tree. We have more follicular units to take from the safe donor areas. That's good news for patients of South Asian descent because it means that we can do greater cases. It means that we can deal with the fact that they have straighter hair, which provides slightly less coverage, by putting more grafts in. Now I'd like to revisit our patient and see how this fed into our decision making for this patient. This is the before and after. You can see it's pretty much night and day. This patient looks like a different person. You can see that we really focused in on that frontal half of the scalp and we packed it with 3,000 grafts via the FUT procedure. Now, 3,000 grafts would have been very, very difficult to take by FUE without blowing the safe donor area. This patient, as I said, had experienced hair loss in the crown as well. So if we did it by FUE alone, then we really wouldn't have been able to take many more than 3,000 grafts to fill in the crown in the future. Look at how this patient's loss lines up with what we've said. He is a diffuse thinner, but we didn't want to pepper those 3,000 grafts throughout the whole scalp in one case. Patients generally want to sort out the front half first because that's the sort of most cosmetically apparent region, and that's what we did for this patient here. We packed 3,000 grafts tightly in the front half of his scalp, and he's able to grow his hair out long here, and we didn't move his hairline. We kept his hairline just exactly where it was because, as I said, his hair hadn't receded. We thought his hairline before the surgery was very appropriate, very age appropriate, had a kind of natural recession which would age well, and that's why we wanted to keep it right where it was. And this is really that money shot again from the same angle. Look at how this patient's face is just much more framed. That's really what we like to focus on in hair transplant surgery. One of our main goals is appropriately framing the face, and having a nice strong but yet natural hairline pretty much always achieves that. This is another angle from the patient's right hand side. You can see he had a kind of patchy loss that we were able to help him out with. Once again, I'm Dr. Parissis with Feller and Bloxham Medical. If you've experienced this kind of diffuse hair loss or any hair loss in general, and you think that hair transplant surgery might be the right approach for you, don't hesitate to click on the link in the description, fellermedical.com, submit an inquiry. If you'd like a consultation with myself and you're based in the UK or Europe, feel free to also use the link and mention my name, Dr. Parissis, or contact my email at drparissis@gmail.com.